Hello, it's Beth here, lead nurse educator at International RN, and today we're going to talk to you about the Bowel Assessment Station for your OSCE exam. So this station is one of your skill stations. It's 8 minutes and it's a written station. So what that means is you don't need to interact with the patient or anything. It's just written. So you'll be given a scenario and then you need to write about it. So what kind of scenario you're going to get? So there's two scenarios. Either the patient is constipated or they have loose stools. So for each scenario, you're going to get a brief bit of information. I'm going to show you one later on about the patient, and then you're going to get a picture of their stool. Then what you need to do is fill out a stool chart for them and write a care plan on what you would recommend the patient. So the care plan for this one, because it's only 8 minutes, it is quite a simple one. It's not as in-depth as your one you have in your planning station. So just need to bullet point nursing care you would do for this patient, dependent on the scenario and if you got the constipated patient or the patient with diarrhea. So as always, I recommend you look through that marking criteria before your exam, but this one is quite straightforward, so we're going to run through it now. So completes the Bristol stool chart is the first point, and obviously dates and signs it. Handwriting is clear and legible. So if I'm talking to you about your handwriting, just please practice it before your exam. There is a lot of handwriting in the exam, so just try and practice it a little bit before your exam where possible if your writing isn't your strong point. So it can make it nice and easy for your examiner to pass you. I have had a couple of nurses fail before because their handwriting was a bit scruffy and examiners struggle to read it. Okay, third point on marking criteria, ensure strike through and errors remain legible. So if you do make a mistake, you just need to put one line through it and just initial that. Point 4, correctly recognises Bristol stool type. I'm going to show you the chart later on in this video, and I think you should be quite familiar with what kind of things we're looking for, but we'll go through that in detail as well. And then you need to write at least 5 points of nursing care for your patient. And then point 5 on the marking criteria is the same for all your stations. Act professionally. You're not really going to be interacting with a patient for this one, so I don't think it really applies, but obviously we always need to be professional. So I'm now going to show you the stool chart to have a look at, and we will go through that. Okay, so looking at your chart, you're first going to fill out the date and the time. So you can either put the time on the scenario or the actual time. They're not really bothered by which one you put. And then you've got all of the types, 1 to 7. So as I said before, it's either going to be constipated or loose stools. It's not going to be any of these in-between ones. So let's just have a look. So it will be either type 1 or type 2, which is constipated. So there's like kind of like hard, kind of like rocks. Or type 6 or type 7, where it gets a bit like loose. So you just need to put a tick in whichever box you've got of the type. So dependent on the picture they will give you, and then you just need to sign it. Underneath that, or on a separate page, they're just going to give you basically like a lined piece of paper where you just need to write the points for the care plan depending on which one you have. So let's run through what care plan you should be writing. Okay, so suggested points for the care plan for this one is considers possible causes of constipation such as medication and explores alternatives. So this might be something like analgesics. We know that that can cause constipation. So in your care plan, you would write, Mr. Smith is taking a lot of analgesics. I would discuss this with the doctor if they can change this to some alternatives. Next point, offers dietary advice like encouraging eating more fruits and vegetables. I would encourage Mr. Smith to eat more fruit and vegetables. Okay, considers dehydration and encourages fluid intake. So Mr. Smith may be dehydrated. I would discuss this with him and encourage him to drink more. Okay, encourages not to ignore the urge to defecate. So I would discuss with Mr. Smith the need to try and open his bowels regularly and not to hold on if he's feeling constipated. Promotes positive toilet habits, privacy positioning. So I would encourage Mr. Smith to try and use the toilet regularly, and would show him where the bathroom is and ensure privacy, something like that. And then last point, recognises the need to continue to assess bowels. So I would continue to monitor Mr. Smith's bowels and fill out a bowel chart for him. So in order to pass this, you need to write a minimum of 5 points. Okay, so we've been through all of the points you can write there. Okay, so the next scenario you might have, so remember you will only get one scenario in the exam, so you'll get either of these, is obviously the patient with loose stools. So they're going to be type 6 or 7. So fill out your chart just as I said with the first one, obviously ticking type 6 or 7, and then I'll tell you what you'll write for your care plan. So the first point in the marking criteria considers possible causes of loose stools such as food poisoning, overflow, medication, such as antibiotics, or health care acquired infections such as norovirus or C. diff. So you can write in your care plan potential cause of Mr. Smith's loose stool is, and then list those things I've just said. Considers infection control measures such as isolation. So next point would be, I would isolate the patient and send a stool sample. Offers dietary advice is the next point. So I would encourage Mr. Smith to eat less fruit or vegetables until the situation has resolved. The next point they say on the marking criteria is to consider dehydration. So you remember this might be quite likely that your patient is dehydrated with this, so you need to encourage them to drink more. So what you would write is, I would encourage Mr. Smith to drink more. Obviously for this one also we need to consider the skin integrity. As you know, the patient could be getting a bit sore, so for your care plan you could write, I would monitor Mr. Smith's skin on a regular basis to prevent breakdown. And last point is, obviously you need to continue to monitor this patient. So Mr. Smith needs to be maintained on a stool chart until the situation resolves. Okay, and that's it for your bowel assessment station. If you have any questions, please write them in the comments. Please follow us on social media if you would like more help on your OSCE exam. We do run courses on the whole OSCE exam as well as CBT, and we also do special courses for resits if you are resitting. And as always, good luck. Feel free to contact us. I'm going to put the email address up for you guys in a minute. Thank you.